If you want to know about the challenges faced by brain injury patients and patients with brain diseases like PTSD, you need to know a little bit about how the human brain works, which is kind of a fascinating story. It's our capacity to commune, to work together, to affiliate, that defines us and defines our success. So when you look at impairment after brain injury or with brain diseases, that aspect of brain function is the area where most of the long-term disability and challenge comes from. We tend in hospital work to readily identify people as impaired if they have loss of function in a limb or loss of vision, if they have what I would call mechanical impairments. Those are obvious, and you can intuit quickly where the challenge is going to be if a person has lost mobility or lost some sensory function, can't see, can't hear, that type of thing. But really the big challenge in brain injury treatment and other morbidities that derive from warfare are changes in our social competence. They are changes in exactly those capabilities which allowed us to be so successful as a species and organize ourselves into groups. So in simple terms, what I'm saying to you is that much of the impairment that really matters in the long term is in patients' challenges in going back to roles as a parent, as an intimate partner, as a friend, as an employee, as a citizen. The modern world is incredibly complex. Those challenges are something that people spend lifetimes writing about and trying to articulate to our young. And if those of you who have raised kids know about this, if you think about the challenges of taking a newborn infant, and newborn infants are pretty much incapable of doing anything. From a medical perspective, they're kind of demented and not viable. All right, I don't mean to impugn babies, but that's just the reality of our advanced brains. You know, still got a lot of growing and wiring to develop after birth. Okay, so by about age 2, our newborn has evolved to the point where, or developed to the point where they can stand up, walk around, dress themselves, feed themselves to some extent, communicate basic needs, and follow directions to a greater or lesser extent. That's roughly the level of function that my brain injury patients are at when they leave a trauma hospital. So we discharge people from Walter Reed and send them to a rehabilitation hospital when they've got those activities of daily living that I just described that are the same degree of development as a 2-year-old, and they can go to the VA and they can do their advanced physical, speech, occupational therapy, rehabilitation interventions. But we have 2 decades of training that go on after age 2 that relate to all the competencies that you need to acquire to be a viable, independent citizen in this world, to use technology to drive motor cars, to manage money, to be a parent yourself, to successfully engage with technologies and the cyberspace world, and all the things that you take for granted, that you all do all day long and don't think about because you've mastered it. After brain injury, many patients lose those capabilities. And so we have front-loaded our healthcare system. We do wonderful resuscitative emergency care medicine. We do fantastic brain surgery. We have got all kinds of tricks that have raised the survival rate in combat injured to the highest level it's ever been in human history. But we don't have the assets for that long-term phase of impairment in those most advanced capabilities that I'm saying define us as a species, that capacity to be part of complex social groups, to subserve all those roles that you take for granted in your life as a parent, as a friend, as a citizen, as an intimate partner, and so on. Those things that we spend 20 years training our children to learn, unfortunately, are often severely disrupted by combat injury. And given that patients are only going to be at Walter Reed for maybe a few weeks, maybe a few months, but they're going to spend 50 years in the community with challenges of that sort, when I reimagine the future of healthcare, I imagine that we have a vibrant public dialogue about that long-term community-based phase of care, which is why I applaud and support this initiative, because we need to look to beyond our hospitals and our healthcare system, to our society, to our nation, to our communities, to our everyday life, to put in place assets and supports that will help wounded warriors survive in that very complex sociological environment that is everyday life. far more challenging than surviving at Walter Reed, where you basically have all your needs taken care of by nursing and professional staff. Going home to the community and getting back in the game of life is the biggest challenge that faces our patients.